Hi, and welcome to another episode of the Rotator Expert. I'm Dr. Daniel Orcutt, and this video today is going to be helping your mom recover after shoulder surgery. As you know, I'm an expert in shoulder surgery. I've helped more than 1,000 people recover from shoulder injury and shoulder surgery, and I want to help you and your loved one now. So if you're dealing with pain and prepping or preparing for surgery, or you're doing this with a loved one, I'm going to break this all down for you so it will actually make sense to you. So no fluff, no scare tactics, right? Just real expert advice from someone who's been through it a bunch of times. So we can help you heal smarter and a little bit easier, a little less stress, because there's a lot of stress involved in recovery from shoulder surgery. So let's get into this. Again, this video is for caregivers, daughters, sons, spouses, friends, anybody who might be helping, or even the person who's getting the surgery. So if you're feeling a little unsure on how to help, you're not alone. It's a lot of things to take in. So if you would, tell me down below in the comments, who are you taking care of? Are you taking care of your mom? Are you taking care of your wife? Let me know. Because these next 9 minutes that we go through could change how you support them and how the recovery actually goes. So this is super important stuff. So when we talk about the house setup, right, we want to make sure the house is clear walking paths, no rugs or cords or clutters. There are lots of people have the throw rugs or the dog toys. These are huge trip hazards. And the last thing you want to do is have someone trip. After surgery, we get a little anesthesia on board, we get the meds, the pain meds, and those trip hazards will become easier to fall or to injure themselves. So it's really important to take your time, making sure we clear all that stuff out so we don't have trip hazards. Also, we want to set up a nice little nest. So when they're not traveling about, we want to have them in a spot where they're safe. They have their pillows, a water bottle, a remote control, their meds. Keep everything within arm's distance, right there, so they don't have to ask. But that's another thing, because the caregiver wants to help, but we also want to keep as much independence as we can with the person who's going through this. So the caregiver's mindset is not, it's okay to remind, but try not to nag. Try not to nag too much about medicines and ice. So I had this one story. We're talking about the trip hazards, that someone actually left a dog bed, right? And their mom tripped with the dog bed, fell, injured their shoulder. So it was really, really scary. Thankfully, everything went fine. They recovered. There was no harm done, but you have to be careful because you could have harm done. So we need to make sure we have a safe and simple home set up for this recovery. And that'll give you confidence, and it'll give the loved one confidence as well. So we just want to make sure we clear that all out for them. So also, next step, we want to encourage, but we don't want to push, right? We want the gentle reminders of, remember to take your meds, remember to take your ice, maybe take some supplements so that we don't get constipated, but don't pressure. We want them to be independent. We want to let them do what they can do, even if it is slow. We want to protect their dignity. We want to ask them if they need help before helping them, especially in the bathroom, in the shower. We want to make them still feel dignified as a person. So I always say, if your loved one can take a couple steps on their own, we should let them do this, right? That's really an independence thing, a thing of making them feel more human. They don't want you all around them just at every little step. So support doesn't mean doing everything, right? It means doing what helps for them to feel safe and in control. We want them to feel as safe as they can and as control as they can in this recovery. So if you have found value so far in this video, if you would just go down there, press the like button, the subscribe button, so we can provide more videos on these kind of topics, more videos on how to recover from shoulder surgery. Okay, we're going to go to the next step. The next step is meals, right? We want to make meals easy to easy to reheat and easy to serve with one hand, easy to eat with one hand, right? We want to pre-make them, and we also want them to be able to be heated easily. We don't want them on the stove, maybe in the microwave with one hand, because you may not be there. The caregiver may not be there the whole time. We want them to be easy open. We don't want the tight, hard lids. You got click, click with two hands. We want the easy, maybe the saran wrap, right? And then we talk about showers. We want to use a shower chair. We want to use a handheld sprayer. We want to do all the things that makes it easier and make them as independent as they can within the showering. We want, there are hair dryer holders. You can put the hair dryer in, then you can just turn on the hair dryer and let it dry you off. That's easy. If you would like more information, we have a dedicated video on showering and getting in the shower. So down below, there'll be a link to that shower video. It's in the description, so check that out. All right, movement, right? Not necessarily movement of the arm, but movement of the whole body. We want to make sure we move every day. We do not want we don't want any just rest. Don't move it all days, right? We have to move. It's good for the heart. It's good for the lungs. It's good for the mental psyche of it too. We want to make sure they are having time to move so they don't get depressed, because it's easy to get depressed. So make sure they're moving, and make sure when they're not moving, they have everything right next to them so they can recover. A little rolling cart with a recliner, next to the recliner, the snacks, the drinks, the tissues. That can be really important. And again, give them that independence. So sometimes the smallest details, like the right towel or the right microwave tray or something like next to you, can make a really big difference to making feel like this is awful and this is just not so great, right? Because it's never going to be great, unfortunately. But we want to make it as less awful as we can, right? Okay, emotions and encouragement. They are going to be tired. They're going to be a little short-tempered. They're going to be discouraged. They're not going to be sleeping well. So do your best to validate how hard the recovery is and help them understand we can't rush through this. It's just going to take time. It's a day at a time. It's a marathon, not a sprint. We have to reassure them that you're not behind. You're just healing. It just takes time for the body to heal. And don't forget, the caregiver needs breaks too, and that's okay. So I have one of my caregivers that would dedicate 10 minutes every day to just get out and walk, get away, get their mental psyche to reset and be ready to be present for her mom, right? So that's important. If you're a caregiver, make sure you have time for yourself too. If you are the one waking up at night to help, thank you. You deserve a thank you for that. That's the kind of love that we will never see in the chart or the MRI or the recovery, but it makes a huge difference for the recoverer, for the patient, for sure. The best caregivers don't just offer help, they offer hope. So please do this. Offer hope if you best you can. And again, make sure you have those times out for yourself. We thank you for being the kind of person who wants to show up, the kind of person that looks through YouTube to get a video like this that will help you help them. That takes a lot of commitment on your part. So thank you. And again, drop in the note down below in the comments, who are you taking care of? I'd be interested to hear. And tell me how it's going. Are you in the midst of it? Are you over it? Or are you just starting? Let me know how it's going. Also, if you want a little more confidence in direction in the recovery, we have a pre-op checklist down below. Just click on it and we'll send that pre-op checklist to you. It's the same one I recommend to everyone who's having this surgery, with their families as well. So check that out. Also, if you haven't seen the most recent video before this one, the 5 truths about early recovery, this is a much watch too, because that tells us a lot about what happened in the first 6 weeks. Super important. So we'll give you more peace of mind, more clarity in this recovery. So again, I say thank you. We appreciate you watching the video, and we appreciate what you're trying to do, trying to help your family, trying to help your loved ones. So thank you and good luck. And please let me know how you're doing. I really want to know.